The following podcast is part of our Best of Invisible Wheelchair podcast for 2017. It was previously broadcast this past year and is being rebroadcast here. Welcome to another edition of the Invisible Wheelchair podcast. I'm Donald Grodoff, family coach with FamilyOCD.com and FocusedHealthyFamily.com. In the Invisible Wheelchair podcast series, I delve into the hidden characteristics of OCD, anxiety, and anxiety disorders. The things that most people don't see, that are behind closed doors and shut within the mind about anxiety. My goal with these podcasts is to bring about awareness of obsessive compulsive disorder, or OCD. Understand that I am not a doctor, therapist, or counselor, and the content, information, resources, and ideas that are talked about and brought up here in these podcasts are things that I have used, discovered, or have been recommended to me, and I always recommend to seek additional professional help in finding solutions for yourself. Thank you for listening and enjoy the podcast. This podcast was recorded March 10th, 2017. This is podcast 1B, What is PANDAS and PANS OCD? Now, last podcast we talked about OCD itself, what it is, what's involved with it. And this podcast, I want to narrow that down, so I'm talking about two specific types of OCD. Like I say, PANDAS and PANS, and I'll explain that in just a minute. OCD, of course, is Obsessive Compulsive Disorder. You know, I talk a lot about OCD because of the experience that I went through with my own daughter some years ago, where she suffered from extremely severe OCD and what happened around that. The experiences that we went through as a family helped me to also come across the idea that it's not just about the person with the disorder or OCD. It's about the family and what they all go through. Now, granted, the person that has the OCD, the person that has the disorder, they suffer more. But the family suffers, or the caring community, as I call it, those friends, family that help and support this person, suffer dramatically also. And so I've really put my emphasis on family versus just child or individual for dealing with this. Now, understand, I do work with individuals, not just families. And sometimes the severity of what we went through, I want to help others in that same place of severity, that same place of hopelessness. So, all the disorders have anxiety as the base, fight or flight, which we're going to talk more about as we go through this series. So I don't want to disclaim anybody because it's not OCD or ADHD to be able to be helped, because that's my goal in this, my passion in this is to help others who are going through that same thing. In fact, last night I had a workshop, and it was pretty much just an intro to some of the work that I do. And I came across somebody that is going through the exact same thing that I went through many years ago. And it was heart-wrenching to see them being in the same place. Everything she brought up in that meeting just reeked of what I went through. And it was somewhat hard to listen to, but at the same time, I was able to be in a place where I felt, hey, this is someone that I can help. So that's going to be the crux of what we're going to do in this podcast. But today, we're talking about PANDAS. Now, PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Infection, better known as strep throat. And let me read the definition from the International OCD Foundation. And that site, by the way, is IOCDF.org. This is their definition, or their description of what PANDAS is. PANDAS is a type of OCD that occurs in childhood following the body's reaction to infection. PANDAS looks very different from other forms of childhood OCD. The most obvious difference being that it happens very suddenly, with the child starting to have symptoms seemingly overnight, and has very severe impact on the child's life. That is what we went through with my daughter, and the sudden impact of it was like a light switch going off one night. And what was interesting, the way we know now that it was PANDAS, was the fact that she did have strep throat about 3 weeks prior to this situation happening for us. And of course, like I said, light switch, one night, it just happens. And of course, I'm going to be telling her story in the next podcast. But I thought it was very important to bring this factor out, because this is a classification that actually, when you know it, there's things you can do to be able to subside this and make it, relieve it, let's say, at least. There's also PANS, and that stands for Pediatric Acute Onset Neuropsychiatric Syndrome. And I'm going to read the same from the IOCDF.org site, their definition or their description of it. PANS is when an infectious trigger, environmental factors, and other possible triggers create a misdirected immune response, results in inflammation on a child's brain. In turn, the child quickly begins to exhibit life-changing symptoms such as OCD, severe restricted eating, anxiety, tics, personality changes, decline in math and handwriting abilities, sensory sensitivities, and more. So again, PANDAS is this sudden onset of OCD caused what they believe to be by streptococcal infections, or as us lay people know it, as strep throat. And what PANS does then, what they kind of start theorizing past PANDAS with PANS, is that it may not be just streptococcal or strep throat, but other things could have play in that, other infectious triggers, as they call them, or infections, or environmental factors that could play into this, that cause this same sudden onset like we had. So, like I said, I found it very important to get this message out, because we did not find out about it. We didn't really learn about it till a couple of years into it. But if caught right away and understood right away, there are things that can be done. But before I kind of get into that, I wanted to, on Wikipedia, there's a definition of it, or a description of it, and a bunch of information about it, really. And you can check that out by going to Wikipedia and just putting in PANS or PANDA or OCD, and I think it'll still lead you here. But I want to read at least the first line out of this, and then it gets very technical. And understand, as I make this disclaimer in my start of this podcast, I'm not a doctor, I'm not a therapist, or a counselor for that matter. I'm totally alternative practices. So what I'm giving you here is just informational from what I've learned through my own personal experience and clients and the doctors and therapists that I do work with. But here's how they describe PANS. PANDA describes a hypothesis that there exists a subset of children with rapid onset of obsessive compulsive disorder, OCD, or tic disorders. So I wanted to read that part, because that talks, again, they use the rapid onset. And that is probably one of the most important thoughts of this. So it happens like a light switch. It happens overnight. There's no warning to it. And if we would have known some of this information and understood it back then, like I said, this for us, it was back in 2010. It could have changed a lot of stuff. Now, I say that for me, that it wouldn't have pushed me into a place that I am now in helping others. So it had its benefit in going through it, even though I don't think my daughter or our family would want that to happen. But it was an experience for me that has taught me so much and led me down a path of more knowledge, more experience, and helping others. So I just wanted to throw that note in that, yes, I would have loved to have stopped the pain, the violence, and all that we went through. But in the same sense, it's taught me so much that I can now hopefully go out and help others in doing it. So one of the people that you can look up that can help in understanding where this came from is Dr. Susan Suedo. She is the one that started this hypothesis around pandas and PANS that helped kind of bring about this theory, and then did studies and tests on it that helped people to see this and start making it more significant around OCD. So you can look up more information about Susan Suedo. You can just really, it's her last name is Swedo, and you can get a lot more information, a lot deeper into the PANS and PANDAS scenario to understand it better. But what I did want to bring about, and here I want to make a disclaimer again that I am not a doctor or a therapist or in any way being able to give this as a diagnosis for you or a prescription in any way. This is just what we have learned as a family, and I have learned as a practitioner, both working with my own personal experience, with my clients, and the doctors that I work with. I work with a pediatric neurologist. I've worked with a integrative pediatric doctor. I've worked with therapists. I have quite a few therapist clients and referral sources that I work with and have taught me so much. Plus, I also work with a gentleman who is my brain scientist that has helped me immensely to understand things to a really sub-level, to a very deep level. And one of the things I've learned that I'm just putting out there for you to know, first off, that adults are very unlikely to get PANDAS or PANS. It's more for children, usually 12 and under, and has been diagnosed as early as the age of 3. With my own daughter, it was at about 7.5 where she came across this. Now, we didn't diagnose it as PANDAS because we didn't really know. And one of the things that I've learned with OCD too is that people have a hard time because they don't know where to turn to, who to turn to, who can I count on to get information about this. And that's what we went through. That was the struggle we went through. And since that time, I've learned a lot of different sources that I can refer people to. So I look at myself as one that can help people through the alternative practices I use, but also as a resource to guide them when it comes to diet, when it comes to where to find other therapists, other doctors that understand OCD, because that is very important. So one of the things that I've learned that can be of help, and again, this is just something I have learned and seen other people use that has helped them immensely. But there's this theory out there, there's this belief out there that if caught right away and understood as PANDAS or PANS, that the use of antibiotics can be I don't know if I want to use the word cure, but it can definitely put OCD down, put PANDAS down, and reduce it down to a manageable and treatable place. And also to understand, one of the things that they do a throat culture to get this information, and sometimes the culture can show up negative in regular testing. That doesn't mean that it is false for PANDAS. And let me read what I've gotten. I believe this might be from Wikipedia. I'm not positive. But this is something that I had been told by others, though. This isn't just from that one source. If a properly obtained throat culture is negative, the clinician should make sure that the child doesn't have occult or hidden strep infections, such as sinus infection, often caused by strep bacteria, or strep bacteria infecting the anus, vagina, or urethral opening in the penis. Sorry, I messed up those terms. I didn't practice that part as well as I probably should have. But just know that just because it came negative doesn't mean there aren't strains of it some other way in other places. And there should be deeper testing in that. So again, it's just a note that has been shown through different sources that it could be possibly more than what can be shown from just a negative strep test. So again, I bring these things out so that you can start working immediately on the issue instead of waiting, because one of the things that I get out in really all the disorders and all those areas of anxiety is that left untended, left untreated, anxiety festers, grows. OCD festers and grows. It grew immensely with my daughter to a place of extreme, and it was not a good place. So I really want to get this message out and spread it to the world to let people know that there is hope for it and there is ways of being able to overcome it. And I'd be happy to help in that, of course. So I hope this helps. Take care. This concludes this podcast. Please remember to leave comments for me, because that really helps me to understand what you're looking for and helps give me fodder for the next possible podcast. Also, I'd love to hear your invisible wheelchair story if you're willing to share it. If you are, feel free to go to invisiblewheelchair.com and click on Tell Your Story. Now, if you've heard these things and you feel like you need further assistance or some help in what you're going through, and you want to spend some time with me working through those issues, then feel free to book a session at focusedhealthyfamily.com or familyocd.com, or simply call me at 704-562-1630. Finally, don't forget there is a tap-in recording following this podcast you may want to take advantage of. I hope you've enjoyed this podcast and will join me for the next one. Remember, keep tapping, talking, and transcending your life into new heights. Thank you, and have a great day.